Before I start, I would like to express my gratitude to the Department of Orthodontics, SDK Dental College, for giving me this opportunity. A special thank to Dr. Rashmi ma'am for extending the invitation to me. Also thanks to Dr. Shalu Bansal ma'am to recommending my name for the topic. So this lecture is going to be divided into two. In the first part, I'm going to explain what artificial intelligence is in a very layman term, in a very simplified manner, so that you can understand what artificial intelligence is. And then in the second portion, I'm going to explain all the possible dental application and the services and the application that are available right now, that you can use right now. So these are the two, you can say, the clear demarcation how the lecture is going to be. But before I start, let me tell you something about me. I'm an oral maxillofacial surgeon with more than 8 years of experience. So I'm also a 3D artist with a 3.5 years of experience. You can see the animation that I've created a few years back for a friend of mine. I use this knowledge of 3D animation to teach the concepts of surgery or anatomy to my students in a fun and interactive manner. So you can see I made a small video to teach the anatomy of the mandible to my students. And I incorporated my PGs in the video. I use this knowledge of 3D animation not only for education, also for surgery. You can see in this, I'm using virtual surgery planning to operate a case, to manage a case of a right angle and parasymphysis fracture. In this, the fractures were reduced in the computer in virtual surgery, and then the reduced fracture segments were printed in the using the 3D printer, and the plates were pre-bent, and the surgery was performed. This reduced the time and it increased the probability of a positive outcome of the surgery. I'm also a Python programmer with a experience of 2.5 years. One of the most notable program that I created is this Telegram bot. The program is actually, I connected the program to the radiograph database of our institute, and now we can use use the bot to view all the radiograph of any patient just by using Telegram Messenger. So I love teaching. I have a YouTube channel which I created back in 2019. I talk about local anesthesia, minor oral surgery, and medical emergencies on the channel. I also have a blog which you can find it at this link. So coming to the topic at hand, so what is intelligence? Oxford Dictionary definition says that it is the ability to acquire and apply knowledge and skills. So the key points to remember in this definition are acquire the knowledge and apply the knowledge gained. So this is a small test for you guys. I'm going to show you a picture of an animal, and you have to recognize the animal. So I'm sure all of you must have guessed that this is a cat. Of course, it is a cat. Then what is this? Again, a cat, right? What is this? It is a drawing of a cat, but it is a cat. What is this? It is, again, a cartoon drawing of a cat. It is Tom from the famous Tom and Jerry. So it is also a cat, a stylized version of the cat. This is also a stylized version of a cat. So you all identified different you can say depiction of a cat without any issue. You were able to recognize it. So this is what human intelligence is. We can correlate things. So now we come to how does a human kid learn things. Okay, so again we're going to take the example of a cat. So to a small kid, we show a picture of a cat or actual cat. We tell him or her that this is a cat. The child sees the cat with the image or the cat, and he makes a picture of a cat in the mind. Okay, that is one. If we show an image again to the child, he'll recognize another pattern of the cat. Again, we show multiple pictures, of course, to the child. So he has an image of a cat in his mind. So the next time when we show the child has learned that this is how a cat looks like. So when you show a very different image of a cat, still the child will be able to recognize that this is a cat. Okay. So if we show, now after that, if we show a cartoon depiction of a cat to a child, he's going to recognize it again, that it is a cat. Okay. If we show it a drawing, the child is going to recognize that it is a cat. Again, the same thing. The child is going to recognize that this is a cat. So this was human intelligence. Now we come to artificial intelligence. So artificial intelligence is somewhat similar to human intelligence. Basically, it is something. Artificial intelligence is meant to make a machine behave like a human, think and act like a human being. Okay, human intelligence. So this we show an image of a cat to a computer, and we tell it that the all the area that is covered by black is a depiction of a cat. Okay, so again we show it another picture, and we should tell it that this black colored area, the whole image that is covered by the black area, is a cat. Okay, so this process is called as annotation. We are marking the area that this area consists of a cat. Okay, so we teach the computer how to how a cat looks like. Okay, so this process is called as annotation. So now that the computer has learned what a cat looks like, you can show it the image of a cat and it will be able to recognize that this is a cat. We show it another image, it is going to recognize that this is a cat. I know बहुत सारी cats हो गई हैं, but stay with me, समझ आएगा आगे. So again, if we show the computer this image, it is going to recognize that this is a cat. But when we show it this image, this doesn't look like this earlier image. Okay, so the computer is going to have a really hard time. Mostly it won't be able to recognize that this is a cat. It won't be able to recognize this also, that it is a cat. The computer will not be able to recognize this also. So this is machine learning. It is going to have some hits and misses. So to overcome that, we have something called as deep learning. Deep learning is just a subset of machine learning. So now in deep learning, what it does is it is going to not only take a overall image of a cat, it is going to divide the image of a cat into smaller segments, which it can then combine and learn and then identify. So here you can see the AI has divided the cat into pointed ears, the round eyes, although the shape of the eye is variable in all the images, but for the sake of this lecture, we'll take it like the cats have round eyes, and the cat has a short and stout nose. The cat has a whisker, मूंछें जो होती हैं, and the cat has a paw. So basically, these are all the features that the AI recognizes, and now what it is going to do is, once it has learned that the cat has these features in it, okay, so the AI is going to go through the image. When we ask the AI what animal is this, it is going to go through the image, and it is going to see that, okay, this animal has a pointed ears, it has round eyes, it has whiskers, it has a short stout nose, it has whiskers, it has paws. Okay, this is a cat. Okay, so again the same thing. Now this is a sketch, but now the AI is going to see pointed ears, round eyes, short stout nose, whiskers, paws. Okay, this is a cat. So the same thing, it is going to identify all the different structures that it has learned. Now it is going to identify them. Okay, so this was deep learning. Basically, AI is a broader term. Machine learning is a subset of AI. Basically, machine learning and deep learning, they are the learning part of the AI, and that AI is going to use that knowledge, that model to apply this knowledge, the gained knowledge, to the real world problems. Okay, basically here in this case, it was able to recognize the animal in the images. Okay, so this was AI. This was AI, machine learning, and deep learning. Okay, then there's something called as segmentation. This is going to be very quick. So basically, the AI has learned to identify and locate an animal in the image. So now it should be able to clearly demarcate where the animal is located, and if required, it should be able to cut it out from the image, from the original image. This process of either delineation or cutting it out is called as segmentation. So AI is not limited to learning only one object from the image. We can teach it multiple objects in a single image. Okay, so here we just tell the computer, the AI, that the object covered by blue is a dog, the object covered by red is a cat. So it will be able to recognize a cat and a dog from a single image. Not single image, but in an image we have multiple objects, and like this we are going to give the AI thousands or millions of the images to train it. Okay. So this was multiple object segmentation. So this where we clearly specify the outcome that you are, this is the data and you are supposed to learn to identify a cat. We have a clear outcome. So where an outcome is specified, it is called a supervised machine learning or deep learning, where the end goal is clearly defined. Then there is something called as unsupervised. In this unsupervised learning, we just provide the AI with the data and we just let it go a while. We allow it to go through the data and recognize a pattern in it. Okay, so that is unsupervised. We don't specify a goal. It is, we are allowing the AI to make its own inferences, make its own conclusions. So here end goal is not defined. An example of unsupervised learning is we feed thousands of millions of images of apples and mangoes to an AI ML algorithm. It is going to go through all the images and then it is going to recognize a pattern that these fruits that are yellow colored, they belong together. And then these fruits that are red colored, they belong together. The machine learning, the AI model is going to identify the pattern. Although it is not going to give the name apple or mango to it, but it has segregated the two things, then we can label them. Okay. So this was unsupervised machine learning. So again, this type of learning is not limited to only images. Images मैंने दिखाई, I showed the images just for your ease of understanding. Okay, it can be used in any type of data. For example, if we feed the health data of millions of the patients, okay, and we just let it run wild, it is going to eventually, among one of its inferences, it is going to find out, it is going to infer that diabetes is usually seen in a person with a sedentary lifestyle. So these are some, this is just an example. There will be multiple conclusions in by an AI. So artificial intelligence is not a new thing. It was first described, you can say, in 1950 by Alan Turing, when he first asked that whether a machine can think or not. Okay, then the term AI was first coined in 1956 by John McCarthy, and in the same year, Alan Newell wrote the first AI program. So this is not the AI machine learning. This is not something new, but it's you can say the progress of AI was quite slow earlier, but now suddenly it has become quite rapid. The reason for this is that now we have a lot of data that has been digitized and we have an easy access to this digital data. And on top of that, to go through this billions of data points, we need a lot of computing power. So all of these two things, actually, the two things, increase in computation power and increase in digital data, that has caused the rapid development of AI and machine learning. Now we come to the second part of the lecture, the application of artificial intelligence in dentistry. So basically, what I'm going to do is I'm going to explain this in a chronological data from a point of view of a patient. So suppose the patient is currently the patient is at home and he feels that his teeth are not clean, or he has a white patch or whatever lesion in the oral cavity. Nowadays we have some apps that can be used to click the pictures of the patient's oral cavity, and these apps they use a machine learning, artificial intelligence in the backend. They can identify the lesions. They can identify whether the patient needs cleaning or whether the patient has caries and needs filling of the cavity. So the patient can be suggested by these apps only that you need to visit a dental clinic. That is a patient-facing apps, patient-facing solutions. Okay, so we have two apps that are currently available in India. One is by Muskan AI and second is ScanO. Both of these, they do something similar, that they click a picture of the patient's oral cavity and then they suggest whether the patient needs to go to a dentist or what the condition is. They help identify the condition. Even in fact, ScanO has a kiosk system also that can be installed at a clinic or a institute. That object that is being pointed by the arrow is a camera. Now this camera can be used to click the picture of a patient's oral cavity at a clinic or the institute, and that picture will be shown on the screen, and clearly overlaying information is being overlaid on the image that is clicked, clearly showing to the patient that this is the area that needs checkup by a professional. So the patient now arrives at a dental clinic. So the first step in dental clinic in patient care is recording a case history. Now, recording case history is like the patient, you ask the patient what his chief complaint is, what is the history of present illness is, medical history, personal history. So the patient is going to speak. Whoever is taking the case history, will have to write it down or type it down in the computer. Now we have the solutions that are available that that can directly convert the speech of the patient into the text. Okay. So using these AI solutions, we don't have to write anything, type anything. We just let the patient talk and it is being recorded automatically in the computer. I'll show you an example. My phone has the feature, Google Pixel, it has the feature of live transcription.
पिछले 5 दिनों से मेरे दांत में बहुत ज़्यादा दर्द है और जब मैं खाना खाता हूं तब बहुत ज़्यादा दर्द बढ़ जाता है.
So you can see I gave you can say a chief complaint, and the phone, it automatically transcripted whatever I said in Hindi font. Okay. Now this is not only limited to transcription. It can also be used for translation. For example, if a patient comes to you and so basically India is a country with different languages. So if a South Indian person comes to a clinic of a North Indian, and the North Indian person is not able to understand the language of the patient. So if he can use these solutions to translate and for easier communication, and then recording of the data in English or whatever language automatically translated. Okay. Then in future, if we have a system where all of the data is connected to each other, all the health data of the patient, and a doctor is allowed to access that data. So automatically the doctor will be able to access the patient's medical history, dental history with a click of a button. So that is one. Then the second step is the clinical examination of the patient's oral cavity. The doctor is now going to examine the oral cavity of the patient. So again, the same thing, we can use AI speech to text for recording of the finding that we are checking, and we are automatically recording the data that is being, the findings that we have. Okay. Then again, the point of automatic translation. Then this is important. Now, majority of the dental clinics nowadays, they have intraoral cameras. So using these intraoral cameras, when we show it to the patient that, okay, this is the caries, sometimes the patient might not be able to differentiate between the tooth and the caries. But if we use the AI systems, when we click the picture using the intraoral camera, and the AI automatically segments the caries section, and it changes the color of that area and show it to the patient. For example, in this image, you can see the caries on the molar, or the caries on the premolar is represented by a red color to the patient. Okay, the patient will be able to clearly differentiate, okay, this is the problem in my tooth and I need to get it corrected as soon as possible by the dentist. So now we have multiple pictures, and we can use these multiple intraoral pictures. We can use these to educate the patient and explain the treatment procedure to the patient. Here in this picture, the AI has shown fluorosis by green color, caries by red color, and in the lower picture, AI has shown the cancer, oral SCC, squamous cell carcinoma by a yellow color. Okay. So when we have this system, the patient will be able to easily appreciate the problem that he has in his oral cavity, and he'll be more prone to get a treatment done. And now imagine if we train a data on these multiple points, thousands of images, and we'll have a AI that is quite good at identifying intraoral lesions, be it oral cancer, be it caries, be it potentially malignant disorders, lichen planus, leukoplakia, erythroplakia, multiple things. Okay. So this is the application of the artificial intelligence at the level of clinical examination. Now we move on, we see a caries, or for whatever reason, we advise a radiograph to the patient. Of course, before that, we'll have to train the artificial intelligence. For example, in this image, we have annotated the fracture line as red. Green color represents the caries, blue color represents periapical lesion. So if we have multiple such data to train the AI, for example, in the IOPA, we have shown the caries as green color, blue color represents periapical lesion, pink color represents the impacted tooth. So if we have thousands and millions of data images, and we train the AI on this, we're going to have a AI that is very good at identifying the structures on a radiograph, be it caries, be it periapical lesion, anything. And to be able to identify different structures. Okay, so this is an example of another AI. Here you can see a filling. Dental filling is shown as blue color. Caries at its incipient stage is shown as orange color. Advanced caries is shown as red color. And then you can see that by the green marking and slightly yellowish marking, you can see it denotes the bone loss. So this bone loss is going to help with the perio treatment to explain it to the patient. So using this, we can explain to the patient that this is the issue with your teeth in the X-ray. Again, we can have the same thing on an OPG or a lateral cephalogram, be it any radiograph. We can use the same technology on different radiographs. In this, the AI has shown that we have multiple impacted teeth. We have the nerve is automatically traced, and we have the mandible that is automatically traced. Okay, so we have the AI. Now imagine if the AI has the access to the clinical image and the radiograph. It can easily combine the two data and get good at a diagnosis, and it will be able to give you better diagnosis. Okay, now this is an example of a service that is currently available in India, that is Better Diagnostics AI. So in this, we have already fed the, it is already trained. So we are just giving the AI an OPG image. And as soon as I click, the timer is going to start. Okay, so we're going to see how much time it takes to trace the different structures in the OPG. So done. Almost 10 seconds, the tracing is done. Inferior alveolar canal, mandibular canal is traced, the condyles are traced, the maxillary sinuses are traced. Although left maxillary sinus is not traced properly, we have the AI can clearly mark that we have multiple impacted teeth in the region. We have periapical infection. We have caries in that region. Okay, so the AI was able to identify and trace all of these structures in 10 seconds. So now I'm going to show you an image of my student, my PG student, tracing the mandible. So actually, I didn't ask him to trace all of the mandible. I asked him to trace all the molars, inferior alveolar canal, and the bone on basically the war lines on the mandible that we usually do for impaction. Okay, so let this video run completely. Okay, so 41 seconds he took to just trace 3 teeth, angle, bone in the angle region, only inferior alveolar nerve, the mandibular canal, and the white line. That is all he was able to trace in 41 seconds. So of course, the AI was way faster and way faster than the human being, of course. But the problem is it was not able to trace the maxillary sinus properly. So there is some hit and miss. Of course, we have to use the AI as an adjunct, not as a replacement. Okay, we can use it to make our job easier. Okay, so this is another interface. This is not a video. This is a clear image. This is another interface by another service that is currently available in India. The service is by Muskan AI. The service is called Dentify. So again, it does the same thing. It identifies the different structures, the pathologies in the bone. Okay? So now we saw that there's a caries in the patient's oral cavity. The patient was told about that, and the patient is referred to the Department of Conservative Dentistry and Endodontics. So here AI can help the AI can help the doctor visualize the caries properly. The periapical lesion or any pathology can be visualized easily, and the AI can even give you the approximate working length of the canal. Okay. Then in orthodontics, suppose there is an issue with the patient has malocclusion and the patient is referred to orthodontics. So we get a lateral cephalogram of the patient. Okay. So again, the same thing. So it is all image. You can say it is all computer vision, identifying the structures and doing the whatever work needs to be done with those structures. Okay. So in lateral cephalogram, simple. on this cephalogram, you can see multiple areas, the points, they are automatically, the landmarks are identified, and then analysis is done automatically. Okay. Using the same AI, if you have using the same AI, you can use it to maintain records of the patient's dentition, the pictures of the patient's dentition, and this AI can automatically create the animation of pre to post video animation. Okay, and this service is called as Dadasaheb. This is okay. This is an online service actually, so you can use it anywhere. So it is also available in India. So using there's another service where we can just there's a software actually we can submit the CT scan and the patient's cast into the software, and the software will be automatically able to recognize all the tooth structures. Okay, the tooth numbers, numbers, and all the points on the cast. Okay, and then using this, it can be used to segment the data. So once the tooth has been identified on the cast or the scan, it can be segmented and separated from the cast. And using that, we can you can just simulate the tooth movement that we want to see in the patient. So this software will be able to show you and show it to the patient what tooth movements will be and what pre and post patient's profile will be. This software is called as Blue Sky Plan. So again, orthodontics analyze it. So if we have intraoral images and we feed the AI the intraoral images and the radiograph of the patient, it will be able to suggest whether the patient needs extraction of the premolar or not. Then if the patient has impacted tooth or any pathology, the patient is referred to oral and maxillofacial surgery department. So the AI will be able to again easily detect pathology and impacted tooth on a radiograph, and it can suggest whether the surgery, the surgical removal of a tooth is going to be easy or not. Here the AI has shown that these impacted teeth, surgical removal is going to be moderately difficult for the lowers and very difficult for uppers. Although I disagree with this, I feel upper one will be easier comparative to the lower one. But again, as I told you earlier, it should be used as an adjunct, not a replacement. Okay, then there's something called a 3D segmentation. So if you remember this video that I showed you guys earlier, in this you can see that I created a 3D model of the patient scan, and then using virtual surgery planning, I reduced the mandible and we printed it. So taking mandible out from the CT scan, from the model created from the CT scan, it takes a lot of time. Even with a lot of experience, I take around 15 to 20 minutes at least to segment, to take out the mandible from that from the CT scan. Okay, this was done with a free software called as 3D Slicer. This was done manually by me. It took around 15 to 20 minutes. This can be automatically done with a software called as Materialize Vision, Mimics Vision. So you just feed the data, feed the CT scan to the software, and it will be able to automatically separate all the structures, teeth, mandible, maxilla, skull, everything will be segmented automatically within a few minutes. Okay. Then again, the same functionality is available in the software, that is Blue Sky Plan. Okay. So you can see in this video that maxilla, mandible, the nerve, the multiple teeth, they are automatically segmented. Okay. This is a functionality that is available in Blue Sky Plan. Now, Materialize Mimic Viewer is a paid software and is quite costly, whereas this is a, you can say, partially free software, partially paid software, Blue Sky Plan, because it allows you to use the software for free. But if you want to, for example, if you want to export the segmented mandible out of the software, then it is going to charge you the money. So that is $20 per case. So it's quite cheap. I would say 1,600 rupees per case. Now, there's another free software that can be used to do automatic segmentation of the 3D model of the patient or CT scan of the patient. So this is a video of that free software. We just click the software, the button, and it is going to automatically segment the mandible, then maxilla, and then the skull. We'll be able to see within a few seconds that it is separating all of the structures. You can see mandible is separated, then maxilla, that done. Okay. So I mentioned earlier, this software is 3D slicer. Now, I mentioned earlier that I used a 3D slicer to for a manual segmentation, but I'm showing here that it is doing automatic segmentation. What's there? What's the catch? So the problem here is like a Chrome browser. We can extend its functionality with some extensions, some add-ons. So here also we can install in 3D slicer. We can install an extension that is called as MS extension that uses a AI, a machine learning to separate the different bone structures. That is segmentation is done within a few minutes. Okay, so you are free to do other stuff, whereas while the machine is doing all the tedious work. Okay, now in implantology, as I showed you earlier, when we feed the CT scan of the patient to the software, it will be able to automatically segment the nerve or identify the nerve and segment the nerve. Then let me show you first this. So as soon as I submitted the CT scan to the AI, you can through the software. Using AI, the software has automatically identified the nerve. You can see the yellow line. That is the nerve that is being automatically marked. Okay. Then there is something called as automatic 3D model alignment, CT and 3D model alignment. So whoever is involved in implant surgery planning, guided surgery, so they would know that if you want to align a CT scan of the patient and the 3D model of the patient, we have to identify at least 3 or more than 3 points on both the CT scan and the 3D model of the cast or the intraoral scan. Then it will be merged once you have identified the different points. Whereas now using AI, Blue Sky Plan can automatically merge the 3D model and the CT scan of the patient. Here, once you specify that the cast is of the mandible, automatically you can see the cast is overlaid, merged with the CT scan of the patient. No manual intervention, automatic way. Then automatic crown positioning. So once you've decided that this is the site where I want to place the implant, so you select the tooth number. You say in this case that is the lower left first molar. So we just select the tooth number. We select the implant size. Now in the video, the operator is going to deliberately click on the wrong side, quite away from the center of the implant site. But still, as he clicks on the site, the crown is automatically placed at the correct position, and the correct size of the crown has been, you can say, designed by the AI automatically. In future, the AI can automatically suggest the implant size also, depending on the available bone and the distance from the adjacent vital structures like maxillary sinus or inferior nerve. Now coming to prosthodontics, CAD/CAM systems in prosthodontics are quite common nowadays. So AI can help prosthodontics to select which material is going to be best for the specific case. And if you want you can feed the intraoral images using the intraoral camera to the AI, and it can evaluate the crown cutting to you. This can be used in institutes to teach your students, be it PG student or UG students, to teach them proper crown cutting. Then in periodontology, again, as I showed you earlier, it can detect bone loss on a radiograph. It can detect plaque and calculus on a radiograph. Plaque and calculus on an intraoral image. Now AI suggests whether, so basically if we feed a radiograph and the intraoral pictures to the AI, it can suggest whether the tooth can be saved or not. Okay. Then there was a study done a few years back in which data of multiple patients with periodontitis was fed automatically, and the AI was able to differentiate between the aggressive periodontitis and chronic periodontitis based on the patient's blood investigations. So again, the same thing, the AI is able to clearly show how much bone loss is there. Okay, and oral pathology is also just vision. We are viewing the slides through the microscope. So we can feed these images to the AI, and AI can automatically diagnose what the disease is, okay, what the pathology is. In this case, it is ameloblastoma. Now imagine we have this AI not only has access to this histopath data, it also has access to radiological data. So it will be able to combine the two data, histopath data and radiological data, and it will be able to better give you a diagnosis. Again, it should be used as an adjunct, not a replacement. So in forensic dentistry, we all know teeth can be used to identify a person. In 2023, Patil et al. Using the AI, they found out that mandibular third molar mesial root length can be used. It can be used to identify the patient's age. Another thing using AI, what we can do is if a victim has a bite mark on the patient on its body, we can use the bite mark to create a rough estimation of the patient of the culprit's dentition. So this is a small animation that I created. You can see there's a bite mark on the patient's hand. So using that, the AI, if we feed the data to the AI, it can automatically create a rough estimation. I'm not saying it is going to be perfect currently. It is going to be a rough estimation of the culprit's dentition. So that was that. So one last thing is robotic dentistry. This is an implant robot, and you can see there's these round balls. This is an arm of the robot, and at the end of the arm they have the handpiece. Okay, you can see the end of the robot's arm has a implant handpiece. Okay, so let's see the video. I'll explain you everything in the video. So this is the arm of the robot. So initially we have to do the virtual surgery planning. We have to tell the software that I want to place the implant here, and my osteotomy site, the drill bit is going to go up to this depth. Okay, in this angulation, this depth. Okay. Now, once we have fed the computer that data that I want the surgery done this way, then you can the computer is going to help you. The robot is going to help you to move the handpiece and place the handpiece and the drill bit in the proper position and angulation. Here you can see the robot is helping the operator in placing the drill bit and the handpiece in proper angulation and direction. Okay. Now, once you have placed this handpiece in this direction, in this placement, in this angulation, you will get a audio feedback from the robot that you are in the correct position. Now, once that is done, you won't be able to move this handpiece laterally. You will only be able to move it in the up and down direction. So you can see the operator is trying to give a lateral pressure on the handpiece. Still, the handpiece is not moving because the robot is not allowing the movement. Now, the handpiece can be moved only in the upward or downward direction. And even in that, the movement will be allowed only till the desired depth of the osteotomy. उससे ज़्यादा नीचे जाएगा ही नहीं. Okay, so this is Yomi implant robot. Then with research, it's quite simple to understand where the application of AI in research is. It is going to be very helpful when you have a lot of data, vast amount of data, and you have to go through it and reach your conclusions. Okay, so AI can help you with research work. Now, patient-facing apps in India are, as I told you earlier, Muskan AI, ScanO, and Dental Friend. These are all the apps. Basically, you have to install these apps on your phone, and you can click the picture of your oral cavity, your teeth, and it can tell you whether you need cleaning, whether there's a lesion in your oral cavity. So it can scan your oral cavity for your oral health. Okay. Then there is something called a smart toothbrush. There's a toothbrush by a company called as Blue. Okay. It is connected to your smartphone. Okay, via Wi-Fi, and as you brush your teeth, your phone is going to update. The app is going to update that you have cleaned this area. Okay, so if it is also going to give you a feedback whether your brushing technique is proper, whether you have missed any area in the oral cavity. If you have missed brushing any area, it is going to tell you that you have missed this area. You should brush properly. Okay, and if you allow the dentist to have access to this live data, the dentist can teach you better how to brush your teeth properly and how to maintain your oral health properly. Okay, now coming to the concerns. So there will be some concerns related to any new technology. First concern is the patient's privacy and confidentiality. Of course, if we feed a lot of data to the AI, we are breaching the patient's confidentiality. So to overcome that, what we have to do is any radiograph that has the patient's information on it, you have to strip that radiograph of that information. Okay, you have to anonymize the data. You can give the AI. The AI doesn't need to know that this radiograph is of Dr. Zibran or Dr. Rashmi or Dr. Shalu. Okay, so AI doesn't need to know who this radiograph belongs to. It just needs to see the radiograph, and it just needs to learn that this is how caries or periapical pathology looks like. Okay, so we can anonymize the data. Then nowadays, many of our people, they ask me, can the AI lead to unemployment among the among dentists? Well, this is completely wrong. AI can never replace a healthcare professional, and especially dentist. Okay, AI can help you with the diagnosis, but it won't be able to do the treatment. Okay, it can suggest you that this is the ideal treatment, but it is up to you whether to follow the treatment or not and to deliver the treatment. If you want to deliver the treatment suggested by the AI, then also you will be used. You have to dispose the treatment to the patient. Okay, so that is one. The dentist will not be replaced by AI, but a dentist will be replaced by a dentist who has the knowledge of the AI. Okay, then comes the problem of legal liability. So earlier, when a doctor does a wrong diagnosis, okay, he is held liable for the wrong diagnosis. Okay, but if a diagnosis is totally done by AI, who is held liable? So the issue here is that again, an AI should be used as an agent, not a replacement. So even if the AI gives you a diagnosis that this is the diagnosis, okay, the patient has caries in these teeth, okay, the doctor, you have to go through the diagnosis and verify it once yourself. Okay, you can't leave all the work to the AI. Okay, so still the legal liability is on the dentist, on the operating doctor. Then the last thing, predictions depend on the precise annotation. Now, as I told you earlier, while training the AI, we have to show the AI that this is the object. Okay, so if the AI gets a data that is wrongly annotated, that is wrongly marked, okay, so the AI is going to learn the wrong thing. Okay, it might recognize cervical involution as caries. Okay, so that is the issue, that a precise AI, to get a precise AI, you need a precise annotation. Okay, so for that we need we need an expert in that field to annotate the data. So ideally, the radiograph should be annotated by a radiologist. Clinical images of perio cases should be annotated by a periodontist. Clinical cases of caries or periapical lesions, these can be annotated by an endodontist. So you need an expert for all of these things, annotations. But it is going to be costly to hire an MDS to do all of this annotation, of course. So there's a system that is currently being followed, is that these companies, they hire dental graduates to do the annotation, and an expert sits at the top level to just review their annotations, and then he approves those annotations. Okay, so it is still being overseen by an expert. Okay, so career options. One of my students, he started as a dental annotator at a well-known firm, that is Vidya Health, that is available in the Western countries. He started as a dental annotator after back-to-back 3 promotions. Now he's an expert reviewer, and the requirement is dental graduation, that is BDS, with at least 2 years of experience after graduation. So you can look into this also. Okay, and these are the AI services that are available outside India. That is Overjet, Vidya Health, Denti AI, Kiroku, Dexis, OraQ. Okay, so these are the services that are available outside India. So the services that are available in India are Better Diagnostics, Muskan AI. So Better Diagnostics and Muskan are the two that are into radiology segmentation, radiograph identifications, whereas Dental Friends, Scano, these are the 2 apps, and Muskan AI, they are patient-facing apps. So that's my mentor, my guru, Dr. Bhavan Das Rai. He's the only reason that I am able to deliver this lecture, because he was one of the few people who encouraged me to, you can say, follow my passion. That is computers, be it 3D animation, be it programming. He was the one who always supported me through all of this. This is me with my residence. And you can reach me here, that is on YouTube. My my YouTube channel, Instagram. You can reach me, you can email me, or you can contact me on my website. There's a contact form on my website. So I hope you found this lecture helpful. Thanks.